Hello, this is Professor Capron. Welcome to this presentation on calculating heart rate. Let's take a look at the learning objectives. By the end of this presentation, you'll be able to understand the importance of accurately calculating heart rate, learn the various methods for calculating heart rate from an ECG strip, and apply the 6-second method, the 1500 method, also called the small box method, and the 300 method, also called the large box method, to determine heart rate. Here are the key terms for this presentation. Please make sure that you learn these vocabulary words. If there's anything you don't understand right now, come back to it at the end of the presentation. If it still doesn't make sense, please come see me in class. Calculating heart rate is one of the most fundamental skills in cardiac care. It's not just about knowing how fast the heart is beating, understanding what that rate means in the context of the patient's overall health and any underlying conditions. Heart rate calculation is critical for diagnosing and managing cardiac conditions. Normal heart rate ranges from 60 to 100 beats per minute in adults. Deviations from this range can indicate various conditions such as bradycardia, a slow heart rate, or tachycardia, a fast heart rate. Recognizing these conditions early allows for prompt intervention, which can be life-saving. There are several methods to calculate heart rate from an ECG strip, and the method chosen often depends on the regularity of the heart rhythm. For instance, irregular rhythms such as atrial fibrillation may be best assessed using a method that can account for variability over a longer period, like the 6-second method. On the other hand, regular rhythms like sinus rhythm are well suited to more precise methods such as the 1500 method or the 300 method. Understanding the context in which to use each method is vital. For example, the 6-second method is straightforward and versatile, making it particularly useful in emergency settings or when dealing with irregular rhythms. By counting the number of QRS complexes in a 6-second strip and multiplying by 10, we get an approximate heart rate. This method provides a quick snapshot that is especially useful for rhythms that are not perfectly regular. The 1500 method involves counting the number of small boxes between two R waves and dividing 1500 by that number. It's highly accurate for regular rhythms, giving a precise heart rate calculation. For the 300 method, we count the number of large boxes between two R waves and divide 300 by that number. Like the 1500 method, it is best used for regular rhythms and provides a quick and accurate heart rate. In clinical practice, being proficient in all of these methods ensures that heart rate can be quickly and accurately determined under various circumstances. This facilitates timely and appropriate clinical decisions. The 6-second method is one of the simplest and most commonly used methods for calculating heart rate from an ECG strip. It is especially useful in emergency situations and for rhythms that are irregular. Let's break down how to use this method step by step. First, identify a 6-second strip. On standard ECG paper, every 3 seconds is typically marked by a vertical line or some other marker at the top of the graph. To find a 6-second strip, you need to count 2 of these markers. The QRS complex represents ventricular depolarization, and this corresponds to a heartbeat. Carefully count each QRS complex, ensuring that you don't miss any, and then multiply that number of QRS complexes by 10. Since the 6-second strip represents 10% of a minute, multiplying the number of QRS complexes by 10 will give you an approximate heart rate in beats per minute. For example, if you were to count 8 QRS complexes in a 6-second strip, that would be 8 times 10 equals 80 beats per minute. This method is particularly advantageous because it can be used for both regular and irregular rhythms. For regular rhythms, it provides a quick and reasonably accurate estimate of the heart rate. For irregular rhythms, such as atrial fibrillation, where the heart rate may vary significantly from one beat to the next, the 6-second method still gives a useful average rate. Some of the practical considerations are the speed and simplicity. That really is the primary advantage of this method. It requires no complex calculations or equipment, and that makes it ideal in fast-paced settings. This method is versatile and can be used in a wide variety of clinical scenarios, including during a code or in any setting where quick decision making is crucial. Now, while it's not as precise as some other methods for regular rhythms, its ease of use often outweighs the slight reduction in accuracy, especially in situations where an immediate heart rate assessment is needed. So, in an emergency, quick heart rate assessment is crucial. The 6-second method allows for rapid evaluation without the need for detailed counting or calculations. For patients with arrhythmia, such as AFib, where the heart rate can vary beat to beat, this method provides a practical average rate that can be used to guide treatment decisions. But while it provides a good estimate, the 6-second method may not be as precise as methods like the 1500 or 300 method for regular rhythms. And the 6-second window may not always capture the full variability of an irregular rhythm, but it's generally sufficient for most clinical needs. Now let's discuss the 1500 method. It's also called the small box method. So first, identify consecutive R waves. You need to locate 2 consecutive R waves on the ECG strip. The R wave is the peak of the QRS complex, and this represents ventricular depolarization. Ensure that the rhythm is regular, because this method is most accurate for regular heart rhythms. Carefully count the number of small boxes between the peaks of the 2 R waves. Each small box on the ECG graph paper represents 0.04 seconds. So for example, if there are 20 small boxes between 2 consecutive R waves, note down this number. The number 1500 is derived from the fact that there are 1500 small boxes in 1 minute, because each small box represents 0.04 seconds, and there are 60 seconds in a minute. 1500 times 0.04 equals 60. So then divide 1500 by the number of small boxes that you counted between the R waves. This calculation gives you the heart rate in beats per minute. Let's say we counted 25 small boxes between 2 consecutive R waves. 1500 divided by 25 equals 60 beats per minute. This method provides a very accurate heart rate measurement because it calculates the exact number of beats per minute based on the interval between 2 beats. It is useful for regular rhythms such as sinus rhythms because the distance between R waves is consistent. Precise heart rate calculation is crucial in diagnosing and managing conditions like tachycardia and bradycardia, where knowing the exact rate can influence treatment decisions. It's best for patients with stable regular heart rhythms, where the R to R intervals are uniform. Accurate heart rate measurement is essential in assessing the effectiveness of medications like beta blockers, which are used to control heart rate. And it helps in monitoring changes in heart rate over time, which can be critical in adjusting treatments for patients with chronic cardiac conditions. Remember that quick and accurate heart rate calculations are vital in emergencies to assess a patient's cardiac function rapidly. But precise heart rate monitoring can guide dosage adjustments for medications that affect heart rate. In cardiac rehabilitation settings, monitoring heart rate helps in safely progressing exercise intensity. Now let's go over the 300 method, also called the big box method. Again, identify consecutive R waves. Remember that the R wave is the peak of the QRS complex, which represents ventricular depolarization, and ensure that the rhythm is regular to use this method effectively. Count the number of large boxes, each representing 0.2 seconds, between the peaks of the R waves. For example, if there are 4 large boxes between 2 consecutive R waves, note down this number. The number 300 is derived from the fact that there are 300 large boxes in 1 minute, since each large box represents 0.2 seconds. So divide 300 by the number of large boxes that you counted between the R waves, and the calculation will give you the heart rate in beats per minute. So if we counted 4 large boxes between 2 R waves, 300 divided by 4 equals 75 beats per minute. This method provides a quicker estimate of heart rate than the 1500 method, so it is more useful in fast-paced clinical settings, not quite as useful as the 6-second method if you really need it fast, though. It's easy to remember and simple to apply without needing a calculator in most cases. And while it's not as precise as the 1500 method, it does offer a reliable estimate that's often sufficient for regular rhythms. Again, this method works best for rhythms where the R to R intervals are consistent, such as sinus rhythms, but it is advantageous in emergency settings where time is critical and a rapid heart rate assessment is necessary. Heart rate calculation is essential for diagnosing arrhythmias. Arrhythmias are abnormal heart rhythms that can range from benign to life-threatening. Identifying the exact heart rate helps to differentiate between different types of arrhythmias. Tachycardia is defined as a heart rate greater than 100 beats per minute. Bradycardia is a heart rate less than 60 beats per minute. But knowing the exact heart rate helps to assess the severity of a patient's condition because a heart rate of 110 to 120 beats per minute might just indicate mild stress or early stages of an infection, while a heart rate of 150 beats per minute or more could be indicative of a more serious condition like SVT or ventricular tachycardia, which can lead to hemodynamic instability. On the other end, a heart rate of 50 to 60 beats per minute in a well conditioned athlete might be completely normal, where a heart rate of less than 40 beats per minute could indicate a critical situation, such as a heart block, which might require pacing. By determining the severity, we can prioritize our care and allocate resources effectively. Remember that heart rate calculation is pivotal in guiding our treatment decisions. It influences all kinds of things about our patient management. For example, let's look at medication administration. Our beta blockers. These are used to manage tachycardia. Accurate heart rate calculation ensures the correct dosage is administered to avoid over suppression of the heart rate. And for our antiarrhythmics, for conditions like, atrial fibrillation or ventricular arrhythmias, precise heart rate measurement helps us to titrate the dose to achieve the desired effects without causing bradycardia. Then we have our emergency interventions like cardioversion and defibrillation. Accurate heart rate calculation helps to determine the need for synchronized cardioversion in tachyarrhythmias or defibrillation in cases of VFib. In cases of severe bradycardia or heart block, determining the exact heart rate guides the initiation of either temporary or permanent pacing. We also need to be able to monitor and follow up. So, establishing a baseline heart rate and monitoring trends over time helps in evaluate the effectiveness of interventions and helps us to adjust our treatment plans accordingly. Regular and accurate heart rate measurement can provide early warning signs of patient deterioration, which can allow us to intervene in a timely manner. Remember, when performing heart rate calculations, always be consistent. Use the same method to calculate the heart rate for this patient for consistency, especially when monitoring changes over time. Verify your calculations, especially if the heart rate seems unexpectedly high or low. Use multiple methods of calculating if necessary, and accurately document the heart rate, along with the method used to calculate it in the patient's medical record for clear communication among healthcare providers. So on the next few slides, I've just printed out a few different practice strips that you can look at. Please think about what would be the not only the easiest and fastest way to measure it, but also the most accurate way to measure it, and work your way through these examples. Go ahead and pause on each screen and take a note of what you find. Pause the video and practice calculating the heart rate. Pause the video and practice calculating the heart rate. Pause the video and practice calculating the heart rate. Pause the video and practice calculating the heart rate. Pause the video and practice calculating the heart rate. Let's do a quick recap. The 6-second method, where we count the number of QRS complexes in a 6-second ECG strip and multiply by 10, is straightforward and very useful for both regular and irregular rhythms, gives a quick estimate of the heart rate. Its simplicity and ease of use make it a practical choice in many clinical situations. The 1500 method, or the small box method, count the number of small boxes between two consecutive R waves and divide 1500 by that number. Best suited for regular rhythms and can be very highly accurate. Gives us a precise calculation, crucial for detailed assessments and when exact heart rate measurements are needed. The 300 method, or big box method, count the number of large boxes between two consecutive R waves and divide 300 by that number. Also ideal for regular rhythms, similar to the 1500 method, and while it's slightly less precise than the 1500 method, it's still highly accurate and easier to perform quickly. Remember that accurate heart rate calculations are not just a technical skill, they're a critical component of patient care. Thank you for your attention to this lesson. Now, get out there and go do some nursey things.